Breast cancer was certainly not on my radar. I mean, it's shocking. At the end of last summer, I was laying on my couch watching a show, and I leaned over and felt the underwire in my bra poke at something on the side of my breast, and I found a lump there. So I went and had it checked, and through screenings and things, was diagnosed with invasive ductal carcinoma and immediately transferred my things over to Northwestern.
Katie had a unique case. The actual area of the tumor in the left breast was overlying her heart, and so it made it very challenging to treat her with standard radiation without increasing her dose to the heart and lungs, which we know can have some negative effects down the road, especially when we expect a patient to do well and to live their full life.
When I found out that photon radiation would have caused a little bit of damage to my lungs and my heart, proton radiation was offered as a choice.
Many clinical trials are asking important questions, and we have several trials here because we want to make sure and also show the amount of improvement that we may see with the use of proton beam therapy.
Nobody wants to be getting radiation treatment, but in the face of something that could have been highly unpleasant, the people here were absolutely wonderful. I haven't been to any other proton therapy centers, but I can't imagine that any of them are better.
Breast cancer patients are a special type of patient. This is an intimate part of their body. I think they really think about treatment regimens. They think about what they want to do to their own body. When a patient comes to the Northwestern Medicine Proton Center, they are entering a facility that is patient-centered, advanced in technologies. We really try to make the patient experience not such a scary one.
Patients will often ask me, what would you do if it were your family member? And I really tell everyone each patient is like a family member, because that's exactly the thought process and how it would impact their life. And we spend a lot of time making sure the treatment is the right treatment for them.
I feel very blessed and lucky to have had the stability of the Proton Center and that treatment available. My prognosis is great. It's difficult to put into words what I would say to the people at the Proton Center and to my doctors at Northwestern. They saved my life.
I think Katie is going to do really well. Thankfully, both of her breast cancers on both sides of the breast was caught very early, and I see nothing but great things for Katie.
Dr. Gentili is fabulous. She is incredibly kind, she is incredibly smart, and she is incredibly good at the job that she does. Nobody expects to have breast cancer at 35, and I think if I can help other people learn or help to support other people who are unsure about decisions in treatment and about proton therapy, then that experience will have meant something and will help people.